And you're live.
Well, this is Senate Appropriations, January 21st. We have the Department of Health with us. And so I'll turn it over to you, Commissioner, to introduce yourself. And then, since we have new members, we'll introduce ourselves to you as well.
Perfect. I'm Mark Levine, Commissioner of Health, and I'm accompanied by my Financial Director.
Paul David, Financial Director.
I'm Pat Brennan. I represent Grant County in Colchester.
Jenny Lyons, Chittenden Southeast.
Andrew Perks, I live in Marshfield, and I represent the Washington District.
Rich Westman, Little District. I also Fletcher.
Bob Norris, Franklin County, and the town of Ellenburg in Grandell County.
Ann Watson, the Washington District.
So you're here to tell us about your budget adjustment request.
Yes, thank you for inviting us to talk about our FY25 budget adjustment recommendations. As we always have had and continue to have, we have 3 appropriations, and the BAA does affect each one of the appropriations this year: administration and support, public health, and substance use programs. If you need to or want to, you can go to pages 9 and 10 of the AHS ups and downs. I believe you received today.
Yeah, that's the thing that Senator Brennan said.
Yes, the colorful. Okay, so I'll just go right into the administration and support appropriation.
It was within, if you're looking online, it was Secretary Samuelson's
Thank you.
spreadsheet,
Well,
because they gave us for the whole agency.
not coming up. Oh, I'm sorry. Go ahead.
And this first one is actually one that does impact the whole agency, and this is the Health Department's share of the AHS service level agreement with the Agency of Digital Services. The total of the $646,940 is the difference between what was budgeted in fiscal year 2025 as passed. And we've done the math for you.
Probably already heard this explained by Department of Health when they were in. No. Okay. The agency at the central office level negotiates a service level agreement. It's both the services to be provided and their costs. And at the time the budget was passed, the final amount was not known.
Oh, yeah, they did talk about
A
it.
certain amount was reserved at the agency level and a certain amount is new money. Those two are combined on this slide. What page did you say it was?
9 and 10.
9 and 10 of the estimate. Okay, well that makes sense. Straightforward.
I'll move on to the public health appropriation, where the administration is requesting $100,000 general fund for a grant to Planned Parenthood of Northern New England for women's healthcare medications. This will provide a 1-year stock of the 2 medications that are used for medication abortion, which are mifepristone and misoprostol. And that will assure uninterrupted access to care for patients.
And is this assisted something that's happened in the past, or is it a new thing?
We did do this 2023. And there's an uncertainty, as you might imagine, with the new administration and the regulatory environment. So we want to be assured that these medications are available in a seamless way. And we've done a lot of research on the previous time in terms of what the state inventory, I guess I'll call it, was, what Planned Parenthood requires for a given year of services, and what the costs were. And $100,000 is much right.
Okay. Any questions about that?
Then we'll move on to the Substance use programs appropriation, where the administration is requesting $1 million plus a tiny amount, additional funding for substance misuse prevention program. So I'll explain that one. This committee has heard a lot about that in the past, but with all this new membership, it's worth repeating now. Under the current law, 30% of the year-end balance in the Cannabis Regulation Fund is allocated for substance misuse prevention activities. When the fiscal year 2025 budget was passed, it included $3 million in the substance use program appropriation for this purpose. $3 million has been the consistent amount year to year. The fiscal 2024 year-end transfer was greater than estimated, and the 30% earmark for substance misuse programs totaled $4,025,125.
What is the significance of that 30%? Why are you? Okay.
Statutory language, so
It's part of
the law says that share of the year-end balance shall be appropriated for substance misuse prevention activities.
No, it's perfect.
Basically a formula.
And it's up to a $10 million. So we're going to use this additional funding to continue the expansion of statewide, long-term, school and community level evidence-based strategies to prevent substance misuse by providing education, positive alternatives, policy changes, community support, and early identification of problems and referral to services. Prevention programs successfully work to help Vermonters of all ages lead healthy lives. The General Assembly had a pretty far-sighted decision to dedicate a portion of cannabis tax revenue to prevent substance misuse. And this now gives us a chance to do the scaling that's appropriate on a statewide basis for some of these prevention strategies and sustain them for the time needed to ensure success. None of these strategies are new. They're all in place now. Most of the problem is scaling geographically statewide to make sure there's equity across the state for everyone. And as you heard, it's fiscal year 2026 when we begin to, the law begins to dedicate 30% of the cannabis tax revenue for this kind of programming, up to $10 million. And we have plans in place to continue to expand prevention programming.
So it's in FY26 that it starts, but this, is that 30% what it ended in fiscal year 25?
It's because it did so well.
The laws there's one provision through the end of fiscal year 25 that refers to the Cannabis Regulatory Fund, into which the cannabis excise tax is deposited. Beginning July 1 of 25, the cannabis excise tax is no longer deposited into the Cannabis Regulatory Fund. Under the current law, it would go into the general fund, but it's still the statutory requirement that 30% be earmarked for substance misuse programming still exists. So the source of funding will be slightly different because of the legislative change in the setup. Senator Lyons probably already answering this than me, but it appeared this is the end of the startup phase of cannabis legalization, where there was front loading of prevention money through a process that was going to eventually turn into a direct signing of cannabis excise tax.
And isn't there a percentage of the excise tax that has to go to prevention?
All it will be is the 30% of the
That's it.
excise tax.
Of the tax instead of
Instead of the remainder from the regulatory fund.
It's fun, I have.
Right. Because at the beginning, the fund wouldn't have had any money. Okay, Senator Norris, do you have a question?
I did. I apologize. I'd have to back up one slide here because I'm a little confused with the Budget Adjustment Act, and you has stated, correct me if I'm wrong, if the last time you did this was in 2023?
Yes, sir.
So is this a new line item, or is this, how does this work? Is this a budget
2023
adjustment?
was the Planned Parenthood medication.
So
Yeah,
that's
that's what he's
That's
asking.
what I'm asking, yeah.
Yeah,
So you didn't have it in your budget last year?
we didn't have it in, that's correct. So we
Okay,
didn't have it in
that's what I wanna get.
24 or 23. It was a one-time, expenditure in 23.
So the adjustment that you're asking for is a straight pass-through on something that wasn't in the budget last year?
That's correct.
Okay, thank you. Let's try to just clear that up in our mind here.
Got it,
it's the environment that has changed.
big time.
Dave?
Sometimes, yeah.
Any questions on any of the three appropriations we just? Because we have two other items to cover.
For that Planned Parenthood appropriation, for medication, approximately how long do you anticipate that supply would last?
My understanding is it's a 2 year supply.
2 years, okay.
Which is about the amount of time one of the medications can be used.
So it's
It has
the
a 2 year
expiration.
life.
Okay, thank you.
Well,
Is it?
yeah.
So we may need to revisit.
Let me just double check, because there was a little bit of back and forth.
Well, you can provide that information.
It's a 1 year stop.
That is the 1 year estimate.
Based on the estimated usage
Oh, you're
projected by Planned Parenthood for services provided in their Vermont clinics.
For 1 year?
Yes.
Cool. Thank you.
No, you're right.
Okay.
Let's go to the next slide then. There are also two one-time appropriations related to our budget. You heard from Commissioner Gresham last week, and he provided the committee with this language. We're talking about section 49 of the budget language on page 32 of the BAA language. The first item is an increase of $150,000 general fund for the legislatively directed household health insurance survey, which should be familiar to many of you. Our department contracts for this survey through competitive bidding. The final contract cost is $550,000. So we need a $150,000 adjustment.
So the bids just came in that much higher, is that what you're saying?
Yes.
Do you receive a lot of bids, or is it like the few providers that do this kind of survey?
A few would be the right characterization, sir. And as it's harder and harder to reach folks, the choice is to either spend more to make more calls or have less precision about the county level data. And there's a stakeholder group that includes representatives from legislative fiscal staff and legislative council, and their recommendation was that the sampling share be as high as the last fielding of the survey so that they would be more directly comparable. So it came in considerably higher than the last time around.
Okay. Yes, Senator.
Is this, I'm not familiar with this at all, so is this a one-time survey or an ongoing yearly survey?
It's been repeated about every 3 years.
Okay.
And they've done it for a while.
For quite a while. There are some people who seem to want the information from it.
It's a great survey.
That was my question. What do we glean from this? I mean, every 3 years, are we showing, what are we showing?
Well, you're learning what percentage of Vermont households are insured with health insurance, what percentage are uninsured, what are underinsured. All categories that are very important.
Questions
You're learning
about
demographics about insurers as well. It is a since you brought it up, it is a point that we actually have debated as well in the past, because there are multiple other data inputs you could use. It might not be as convenient as this survey, finding all of these data inputs that would contribute the information that this survey has. And in a time of budget austerity, one might consider, well, why utilize the survey at all? We failed to make that case last time. We tried, but the legislature actually wanted to continue to see the survey. And here it is.
So you tried to walk away from this more or less because of,
We'll offer it as a place where state money is used in other ways rather than the
Okay.
survey. But I'm not denigrating the survey by any means. I mean, it does provide very useful information, and it turns out a lot of people do refer to it. And as we're talking about healthcare reform now and what programs to move forward with in healthcare reform, information like this is helpful.
oh, it's fine, I'm not denigrating the survey either, I'm
Yeah.
looking at the cost of the survey.
It's
That's all I'm looking
Yeah,
at.
these things are expensive.
They're expensive.
Yeah, that's the problem.
So since the survey is used by people in state government for administrative purposes, and we bill off to Medicaid for that, has anybody ever asked if this is an allowable use?
Unless I can tell you that we have not discussed that directly with AHS central office, partly because we don't think there's any chance of this being Medicaid eligible.
Okay.
It's a Vermont law directed mandate that is intended to assess health status for the entire population, and I can't make any medical connection with.
Well, when you're in a
It's
state
worth
where
the
40% of the state has something that is Medicaid, and if you're talking about anybody that might be underinsured, I would think that information is to run our programs is not, so that's where the question
And we've
comes
made
from.
that connection in many cases. I'll be glad to raise.
No, I, if you don't think it is, but I just, if you're administering programs and particularly those people that are at risk, and you're making decisions, information is important thing to have.
Our final item is a one-time appropriation of $500,000 general fund for community grants related to health equity. In the fiscal year one-time budget, the General Assembly appropriated base funding and Office of Health Equity, along with one-time funding for community grants to the Agency of Administration. The administration has opted to establish the Office of Health Equity in the Health Department. So the budget adjustment language reflected here would transfer the one-time appropriation for these community grants to the Health Department, where we will administer them.
So the transfer of funds to this and to the previous, household health insurance survey, does that money come from the fund, the cannabis fund, or not? No, okay, so it's not okay,
Completely.
totally separate, okay. General fund.
So the funding mechanism for all three of these line items we're looking at is simply just for the general fund. There's no mechanism for funding for these three areas other than,
These two areas.
well, you had, this is the 500,000, you were at 550,000, you had 100,000 for the, so that's three items, correct me if I'm wrong.
Refer to the 100,000 for medication. Senators.
Yes.
Yeah,
Yeah, oh, okay.
they're all general fund.
They're all
Yes.
general
One-time
fund.
general fund appropriations, they won't be in, they aren't added to the department's base.
And on the ups and downs, where's the 550? Let's see that. There. And then,
Might it be 150?
oh, it's one, where's the 150?
I didn't see.
Do you see it?
No.
Where's the what? It's the 150 for the increased survey cost.
Right there in front of us.
They had it on their screen,
I
400 to 550,000.
haven't found it in here.
On this, so the first three slides that we presented are showing up in the ups and downs. It's just the last two items. The additional funding for the household health insurance survey, which was not in our base budget, was in the section B 1100 under the budget.
That was a long time.
Right, and then, the 500 transfer is another one in the B 1100 section.
In the what section?
The
The 1100.
The 11.
of the budget as it shows up on.
So it wouldn't show up in ups and downs because there
No,
wasn't
the
anything there, so it'd be in the,
In the language that was provided to.
It would be in-
Aggression, it's on page 30.
would be on that big sheet that the correction showed us, it would be on the bottom pages of that. Where you have the one-time sheet. Okay, did you have another question?
Yeah, just for the community grants related to health equity, could you just, help me out with an example of like what something might be for that?
Oh, yeah, a whole list of them.
Okay. Or you can also just follow up with me later.
Yeah, we can follow up.
That's fine. It's helpful to know, to have something to anchor.
Yeah,
Like, what
yeah, I had the
that
same
looks
question, I wasn't sure what a health equity grant would be.
Well, there are two community organizations that actually help us connect with and provide services for groups that might otherwise not be, well, I guess you consider them potentially marginalized groups. Whether that's defined by racial equity, whether that's defined by gender equity, disability status. So there are organizations that generally represent those groups and help accomplish important public health goals. Most of the time, the groups I'm talking about, if you look at our Vermont data, show tremendous disparities in the data. Whereas the average Vermonter looks incredibly healthy, the profile we see of these groups is much different than that. So, but we can give you the actual grants that were awarded and give you a good illustration.
Sure.
Dr. Lee, the furniture grants were awarded under a federal grant that we received to address health disparities. That was money that, it's not an ongoing federal grant, and was for several fiscal years. And it was a pretty substantial grant, several $1 million of community awards. Initially, it was focused on addressing some of the health disparities that were still present before the end of the COVID-19 emergency, such as access to health care for undocumented workers.
Hopefully we can still refer to the words health equity in the future. But a number of other states have more experience with that than us, and they've already figured out other ways to refer to the same concepts.
Okay, any other questions? Anything else you want to tell us?
We're a wealth of knowledge about public health, but
Anything you want
I'd
to tell
hate
us
to cherry
about?
pick and cherry pick something particular. And this committee often does pick my brain though.
Yeah. Yeah, we're still getting our feet under us, so
Yeah,
maybe next time we're back, we'll ask you about other medical questions.
not a problem.
Okay, if there's no other questions, then we'll let you go. Thank you, Dr. Levine.
Thank you.
Thank you,
Good to
Mr.
see you
Taylor.
all.
Thank you.
See you.
Okay, with that, we're done for the day.